Now I hand over to Dr. Kailash.
We are all connected.
Good afternoon. Dr. Prakash, we just give you a brief introduction about our members. We are all from independent medical practitioners and IIT Chennai Metro, the group. Normally we meet on the last Sunday of every month here. Before we have mini conference. Normally we have 3 topics, but today alone we have 2 topics. Because very hot. So, and for your members' information, next month, May month, we will not have a meeting because it's going to be extremely hot. And I'm also not here, I'm going to Kashmir, I won't be here. So, we won't have it. Anyway, this topic, which of course Prakash has introduced me to Dr. Sajjan, the topic, spectacular vision without spectacles after 40 is fantastic. I mean, so I only hope I was 40 years old, but now I'm 30 years, so I can't help it. But I still feel that the topic seems to be very, very exciting. How a person can be without spectacles after 40 years? Because 40 is the first time I had the first spectacle for presbyopia. So without spectacles, if I am able to handle my life, I'll be very, very happy. In fact, after cataract, many people don't wear spectacles. My mother, she's 90 years old. After her cataract, she's not wearing spectacles, she's able to see well. So, if what you're going to say is not any surgery, no? It's not surgery. It's surgery. Okay. My daughter also had myopia, severe myopia, 6 and 7 and all that. Some surgery they did LASIK, and after that she did not wear any specs at all. So, in fact, here I think 80% of them are having spectacles here. So, after the lecture, most of you may throw away the spectacles, and we're only hoping for take a stick. Yeah, take it. Wonderful. So, and of course, the next topic is diabetes. All of you know that diabetes is a part of our practice every day. Particularly in general practice, if you come across diabetes, what drug to give is being a big problem for us. So, Sundaram is such a nice speaker. He gives you simple tips what drugs to use for diabetes. Now, the question comes: if this is sugar, what drug? So, it will be an eye opener for you, particularly for cancer. So, with this introduction, I welcome every one of you. And now I request Dr. Subhash to introduce the speaker, and we'll have this conference for him. Welcome.
Thank you, Dr. Prakash. Good afternoon to everyone. It's my great pleasure to introduce Dr. Prakash. Long list of achievements and awards. He's from Stanley, and he had his infantry after from Aravind Eye Hospital, Madurai, ICO from Cambridge, UK, FRCS after from Glasgow, UK, Ratan Tata Fellowship from Shankar Nethralaya, Chennai. Former medical director, at present he is Chief Eye Surgeon, American Eye Care Center, Chennai. Former medical director and head of postgraduate education. I'm training at Dr. Agarwal Hospital. A pioneer in sub 1 mm phacoid surgery and no anesthesia cataract surgery. First eye surgeon to document that cataract surgery can be performed through sub 1 mm incision. In 2003, for which he received Best Paper of the Session Award from Tamil Nadu Ophthalmic Association in 2003. Designed an instrument for sub 1 mm cataract surgery called Prakash Turbo Chopper. That was his achievement. And then innovator of a new modification in phacoid surgery called cut sleeve phacoid. This was published by him in Ocular Surgery News USA and Asia Pacific editions in 2003. Designed a new eye examination protocol called American Master Eye Checkup. And he devised a new scoring system for vision assessment by eye care providers called the Prakash Perfect Vision Score. He has performed live, no anesthesia phacoid surgeries at eye hospitals in India and abroad. He has taught the nuances of no anesthesia sub 1 millimeter cataract surgery at live surgical conferences at Mauritius, Libya, Delhi, Bombay, Pune, Hyderabad, Vijayawada and Chennai. He was invited faculty and guest speaker at the WHO conference, All India Ophthalmic Society meet, Tamil Nadu Ophthalmic Association meet, VASCON, Indian Intraocular Implant and Refractive Society annual meetings. Author of the book called OSD Ophthalmology. Conducted more than 1,003 glaucoma cataract surgeries per year. And he has received many awards and recognitions. Doctor's Day Award in 2016 by Kampa and IMA Central Chennai, and Icon of the Year Award 2017 from France Academy, Icon of Chennai City Award from Radio City 91.9 in 2018, and he has got his clinic at Varshavaakam, KK Nagar, Aruvakam and Tirupati Nagar, Chennai, and he has received awards from the actress, famous actress Jayapratha in 2015 and from actress Lisa Ray Hayden in 2015, and ranked number 1 eye clinic in Chennai by Times of India newspaper in 2022. So now I invite Dr. Prakash to deliver the lecture. Thank you.
Thank you, madam. Good afternoon, everyone. First of all, I would like to thank Independent Medical Association, Independent Medical Practitioners Association of India and IMA for giving me this opportunity to speak to you about an interesting topic, spectacular vision after 40 years. This is a fairly new advancement in ophthalmology. Not many ophthalmologists are practicing this, what I am going to talk now. And yesterday we had an eye camp specifically for this purpose, and there was an article published in Times of India specifically for this purpose about how to achieve spectacle-free vision for those above the age of 40 years. So the name of the procedure is actually, it's coined by me, it's called Plex EDOF. PLEX stands for phaco lens extraction with extended depth of focus IOL. That is the name of the procedure. I'll be talking about it later. Now, one of the most interesting and universal phenomenon about our human health is that exactly at the age of 40 years, almost everyone gets presbyopia. Still, nobody knows why that 40 years is that significant. It is something, a mystery, even till date. Nobody has unraveled that mystery. Is it that God is telling us that we are old or at 40? I don't know. But everybody develops presbyopia, and why it happens is the lens loses its, the human lens loses its elasticity, and the zonules also become less effective in altering the focus of the lens. How is it that I am able to see here, I am able to see there, you are able to see far off and near? Is because your human lens is able to change the focal length nanoseconds so fast that I think I'm audible without a mic, right?
If you have the mic.
Thank you. So we have the ability to continuously change our focus from at any distance. But for looking at close objects, the zonules, the ciliary muscles of the eye should contract and it should relax the zonules. It should make the human lens more curved. Only when it becomes more curved, he can focus on near objects. And this continuously happens every minute, every second in our lives. But somehow at the age of 40 years, this stops happening. So what happens at the age of 40 years is that you will need glasses to read. If you don't have any power for distance also, you will need glasses to read. Or if you have already a power for distance, you will need a power for distance and a power for near. Now that is known as presbyopia. Now, why we can't see without glasses after 40? Because, as I said earlier, some of us are myopic, some of us are hypermetropic, or some of us have astigmatism. Astigmatism is cylindrical power. It can be both myopic astigmatism and hypermetropic astigmatism. Because of these reasons, we have to wear glasses after the age of 40 years. And on top of that, we have presbyopia also. Now, less than 40 years, if somebody wants to be without glasses, what we offer them is a surgery known as LASIK surgery. That is a very simple and very easiest of all surgeries, very most dependable, most predictable and least complication procedure is LASIK surgery. We have been doing LASIK surgery for past more than 20-25 years and the results have been improving every year. Today we can have 98 to 99% accuracy with LASIK surgery.
Only for myopia.
Even for hypermetropia we can do LASIK. But it should be below the age of 40 years.
So lifelong they may not use specs.
No. For lifelong they need not use specs for distance vision. So if somebody has myopia and we do LASIK for them, myopia na durama paakradhu theriyala. Durama paakradhu theriyala, we can do the LASIK surgery and correct the distance vision perfectly for lifelong. But that same person at the age of 40 years, they will develop presbyopia, where they have to wear glasses for reading. So even after LASIK surgery, at the age of 40 years, everybody starts wearing glasses.
What is the minimum age of LASIK surgery?
The minimum age we prescribe is above 18 years. After 18 we can do. But generally I prefer 20 years. We want to wait and watch whether the power becomes stable or not. The age is one criteria, but power is another important criteria. If the power keeps changing, when a person comes to me this year and the previous year prescription is different from this year, I will not advise LASIK for that person. I will wait until the 2-year prescriptions are the same. Only then LASIK will give lifelong benefit. Otherwise, we are seeing a trend in that person that the power is changing. If I correct today, then tomorrow or 1 year later, the power increase can happen. So,
You mean to say that after the age of 20, power will not?
Generally, myopia. See, when we talk about myopia is due to increase in the axial length of the eyeball. The eyeball keeps growing. And I think some changes happen in the eye at the age of 18 to 20 years that power stabilizes. We have seen this happen for many patients. So based on our assessment and our experience, we have suggested this. So most important thing is LASIK surgery cannot treat presbyopia. So even after LASIK surgery, people will become presbyopic at the age of 40 years and they need to wear glasses. Now, I am going to show you how the LASIK surgery is done. This is a femto-LASIK surgery, what I have done. Here a laser is passed and it goes under, it is real time. You are watching everything, it happens exactly in 5 seconds or 4 seconds. So now a layer is created within the cornea. This layer, now I will remove this layer on top like this. That is about 100 micron thickness. So it's a 100 micron flap which is lifted. The laser has created the flap. Now we will use the excimer laser to do the power correction here and put the flap back. The whole surgery actually lasts less than a minute. That's all. It's real time. For -3 power I need 12 seconds. For -6 power, I need 30 seconds. That's it. So LASIK surgery, very simple, very straightforward. We are not entering the eye, we are doing everything on the cornea. But the most important thing in LASIK surgery that doctors should understand is power should be stable. That's number one point. Because if power is not stable, once again, inherently the axial length will increase and myopia will come. This is first thing. The second thing is the cornea should be able to withstand the LASIK surgery, which means the cornea should have adequate thickness. Normal corneal thickness is 450-500 microns to 600 microns. If you choose a cornea which is having a lesser thickness, you are making the cornea more weaker. So if you make the cornea weaker, it cannot resist the intraocular pressure. Normally intraocular pressure is there. A thin cornea cannot resist the intraocular pressure, so it becomes a conical cornea. Keratoconus will happen. So patient selection is very important in LASIK surgery.
How to measure the corneal thickness?
We measure corneal thickness by two methods. One is optical, another is ultrasound. So optical is OCT. By OCT, optical coherence tomography, we can measure the corneal thickness without touching the eye. It's a very simple, straightforward, everyday procedure that we are doing for almost all patients nowadays. And ultrasound, previously we used to touch the eyeball and measure the thickness. We no longer use it.
Where is it after cataract surgery the vision comes completely gone?
Yeah, you will know the answer. So, to answer your question, so we can correct the power in the eye in two places. One is cornea. The other place where I can correct the power in the eye is lens. Even in the myopic person, I can correct the power in the lens. If I don't have a LASIK machine, if somebody is in the rural area, they don't have a LASIK machine, then the doctor can do the surgery in the lens and correct the power. So that's known as lens-based surgery. Lens-based surgery is the best option for presbyopia. Because if you do a corneal-based surgery, you are not tackling the lens. The lens will become presbyopic. So to handle presbyopia, lens-based surgeries are much better than corneal-based surgeries. So to answer Kailas's question, when we do cataract surgery, we remove the cataract. Then we put an intraocular lens. That lens, when we put, we have the option of correcting your myopia, your hypermetropia, your astigmatism, and presbyopia. These are the recent advances in cataract surgery that presbyopia can also be corrected along with power correction.
It means that 20 years everybody can remove the lens and put the fresh lens.
Yes.
For life you will not have cataract.
Yes. Yes. This is where the ophthalmology is evolving. We are no longer handling blindness. We are now handling vision enhancement. This is the goal of ophthalmology today. Previously, we used to conduct camps, make blind people to see. Today, everybody is seeing well. Now they want to see without glasses. So, cataract surgery, how we do it today is we do cataract surgery without any anesthesia. At least I don't do any anesthesia for my cataract surgeries, and we have given up on this injections. Peribulbar injection used to be given for cataract surgery. Today, just like how cardiologists are doing beating heart cataract surgery, heart surgery, we are doing moving eye cataract surgery. When the eyeball is moving, we have trained ourselves to do the surgery even when the eyeball is moving. So, you will see the surgery show soon. And cataract surgery we are doing through the clear cornea. As you all know, cornea does not have any blood vessels. So when we do any surgery through the clear cornea, it is a totally bloodless surgery. You will have many patients, cardiac patients, on aspirin, on ecospirin. Frequently I get this question, Doctor, by Medical Council of India rules, yes, I have to stop. But as a surgeon, I don't need you to stop any medication for me to do a cataract surgery. Number one. I have many patients who come with diabetes and hypertension. They say, the BP 180 I don't care. Whatever your BP is, I can do the cataract surgery because there is no blood involved. Why am I bothered about the blood pressure? I have done cataract surgery for a patient with 220 blood pressure on the table. I have been monitoring the BP with the monitor. So nothing happens. But for medical legal,
Glaucoma? Venkataeswara, glaucoma?
Glaucoma.
Will you do it?
Will you do cataract surgery with glaucoma?
no. Glaucoma is a totally different thing, madam. Only we are talking about cataract surgery. Glaucoma is a different procedure altogether.
What I'm asking is, will you do the surgery in a person with glaucoma?
Yes. There are many patients who have coexistent glaucoma and cataract, and we have to do the surgery for them also. So that's not an issue at all. You see, if the pressure is high, once I put the incision, the pressure is going to come down. So after that, where is glaucoma? There is no glaucoma when once I enter the eye, there is no glaucoma. So I can do the surgery.
The patient has a violent cough.
Sir?
Patient has a very violent cough.
Cough.
Asthma.
Yeah.
Are they fit for this?
I have patients who had cough on the table. I just take out I usually do the surgery with exactly an instrument that is there on your table like a pen. That is the size of the instrument with which I am doing the surgery. The tip of the pen is 2 mm to 1 mm. The tip of my phaco probe is also 2 mm. So I cut the eye only for 2 millimeters, and you will see the surgery shortly. So I just take the probe out and say, previously, we used to do open globe. We used to cut the eye for 10 millimeters, leave the globe open, remove the cataract in toto, and then suture it. See, in those instances, when the globe is open, if somebody is coughing, all the contents inside the eye, including vitreous, iris, everything will come out. Today, we are not doing open globe surgery. We are doing closed eye surgery. We are not exposing the eye to atmospheric pressure at any point of time. The intraocular pressure is always maintained when we do the surgery. And so it is painless. Now I can guarantee cataract surgery is painless. I have been doing cataract surgery for more than 20,000-30,000 patients, and now I can safely say, even without anesthesia, cataract surgery is a painless procedure. Patient can have apprehension, patient can have anxiety, but patient will not have pain.
So is there a local drop?
We use Paracaine, which is a surface anesthetic. But honestly speaking, I have also done cataract surgery without Paracaine also. That is called as truly no anesthesia cataract surgery. I performed this surgery in front of 50 newspaper reporters, journalists in Vijayawada. I did the surgery, and we proved that we can do the surgery without anesthesia, and patient walked back and said, I didn't feel anything. So it's more of a psychological thing than anything else.
In fact, can't come for the surgery and surgery without anesthesia.
See? So, but any anxious patient, apprehensive patient, you have to do some other things, like you have to sedate him or something like that. But generally, it is not required. But it is a mystery. You can't even have one small foreign body in your eye, you cannot sleep. But I can cut your eye with a knife and you will not do anything. So, it's a paradox.
But anyway, the eyelids will be kept open.
Yes, we use a speculum. It's a clip. We just keep the eye open with a clip. That is the only thing which will be probably painful to some people. Sir?
How long they should take rest after the surgery? They can resume their office.
I'll tell you what I do. I tell my patients to resume all their normal activities the next day. Very next day. They can take head bath after 3 days. They can read, write, use computers, driving, television, everything they can do, cooking, household work, everything they can do the next day. But many of my patients, they can cook on the same day, and few of my patients have driven their car and bike home immediately after exiting my operating theatre. After the surgery, theatre mudichittu அப்படியே அவங்க வண்டி ஓட்டிட்டு அவங்க வீட்டுக்கு போலாம். We don't put any bandage, we don't give any this thing. They can wear a goggles if they have some fear that some dust will go inside.
No smart glasses.
Not necessary, sir. So now I will show you how the cataract surgery is performed. This is a live surgery which I performed in Delhi. Delhi Ophthalmic Association, they invited me. So this is the lens actually. You can see this is the cut in the eye which I have created. That is 2 millimeters. Now what you are seeing is about 100 times magnified. So we do surgery only through a microscope, and the lens actually is rolled and pushed inside the eye and it unfolds. This is around 12 millimeters. This is 12 millimeters. The cut is 2 millimeters. So through a 2 millimeter incision, a 12 millimeter lens is rolled and injected into the eye. So now you see this is the incision which I created, and now I am making a. If you know the anatomy of the eye, there is something known as a capsule. What you are seeing now is a capsule. So this capsule is thinner than the onion peel. Thinner, 100 times thinner than the onion peel. We have to make a perfect circle by using just a needle. And after removing the capsule, we use this equipment. This is called as a phaco-emulsifying probe, and this is a chopper. This is a chopper which I designed. So we just hold the cataract with the probe, and then with my left hand, I just cut it. It is just like cutting pizza. Just hold it, cut it. So we rotate the lens and cut it into 5 or 6 pieces, and then the probe itself, it has got fluid which is going inside, it sucks it up. So the cataract is basically emulsified using ultrasound. The probe vibrates at 40,000 times per second. So that creates cavitation energy, and that cavitation energy dissolves the cataract. So if you see, the whole cataract is getting removed. It is usually a 10 to 15 minute procedure. Then we clean it up. So we created a hole in the lens. The capsule we removed the top. So there is a bag, and we keep the lens inside the bag. So anatomically we are keeping the new lens in the same place as the old lens.
You don't touch the posterior capsule.
No, we should not. If the posterior capsule is broken, then it is actually the lens will not stay in place. The posterior capsule holds the lens.
Anteriorly, sir.
Sir,
Anteriorly, we remove
we make a hole in the anterior capsule.
so then it still remains at the lens.
Yeah.
Posteriorly.
Posteriorly, so we create a bag like thing. The lens is biconvex. On the top layer of the convex thing, we create a hole to the top layer. So now the cataract surgery is almost over, and we have, in this patient we have implanted a multifocal lens. I'll tell you the differences in the lenses. Yeah. Now, until 7 years or 8 years or even 10 years ago, we had only one type of lens known as single vision lenses, which means that lens had only one power. So every cataract patient, after the surgery is done, they have to wear glasses. That was the rule. Then came the option of multifocal lenses. These multifocal lenses actually have rings in them. If you see, this is the actual eye photograph of a patient in whom the multifocal lens. I have taken the photograph of the patient in a slit lamp. You see, there are rings in the lens. So by using these rings, they created 2 different powers, distance and near. Just like the Fresnel prism. If somebody has seen a Fresnel prism is actually like this one here. So the multifocal lens gives the advantage to the patient that they can read and they can also see distance. Now the problem with the multifocal lens is that because of the rings, the patients experience glare and halos when they look at bright objects. Especially, what is a bright object? An automobile light which is coming in front of you, or you are walking on the road and you are seeing a street lamp on the top. That lamp, if you see, or if you see this light, surrounding this light, you will see rainbow colored halo. So that is because of the diffraction that happens in these rings. That was one problem which we were not able to solve until last 2 years ago. So patient had to live with it, and then they started to ignore it after some time. This problem was not there for everybody. A few patients used to complain of this glare and halos with multifocal lenses. So now what we have is known as EDOF lenses. EDOF means extended depth of focus. These EDOF lenses don't have the rings and they work like multifocal lenses. So using laser, the surface of the lens is modified and this lens gives the most natural vision as near to what God has given us. Still not as good as God's vision, but at least we are coming close to that. So with a person with an EDOF lens can see both the distance and the near without glasses and without any glare or halos. So now we are offering these EDOF lenses to patients without cataract and with cataract. If you have cataract, very well and good, because you have an indication for surgery. It is not a cosmetic surgery. But there are people who don't want to wear glasses. I have seen so many patients, surgeons especially, they will say, I cannot see the suture properly. Because suture is at one place, my monitor is at another place, endoscopy I cannot see, I cannot do this laparoscopic surgeries. Surgeons who play billiards, they are unable to use their spectacles for playing billiards because they have to do like this, and no spectacle gives you good vision if you see like this if you are wearing a progressive lens. So there are situations where spectacles cannot give you the desired vision. You can adapt, but that is not the ideal thing to do. So now we are able to offer those kind of people this EDOF lens. And how we do this EDOF lens? We do the same cataract surgery, which is known as phaco lens extraction with EDOF IOA. So the benefits of this EDOF lenses are, since they don't have rings, there is no glare, there is no halos, there is no waxy vision, and we can also correct astigmatism when we are doing this EDOF lenses. That's known as toric lenses. So we can correct the pre-existing corneal astigmatism. Everything we can do when we do this surgery. I don't know how many of you can see this. In this person has had a multifocal lens. That person, wherever there is a light source, you can see surrounding the light source there is a fuzzy border. It is not clear cut. This is the problem which a multifocal lens person will experience. The same person, if he comes to my clinic and if I ask him to read, he will read everything. The 6x6 line he will be able to read because there is no glare there. But when he goes outside, that person sees this. Similarly, some patients also develop this kind of blockage in the vision will be there. We still aren't sure why it happens, but some patients do complain of this known dysphotopsia. So with this EDOF lenses, we are now able to do away with all these problems of multifocal lenses and trifocal lenses and single vision lenses. So the challenge to this, then you can ask me, why we are not doing this for everybody? Why don't we advise everybody instead of wearing glasses? Why don't we do the cataract surgery and do the Plexidorf surgery? Every surgery has got a minimal amount of risk. We don't want to subject a normal human being to that risk. So the biggest risk for any surgery is endophthalmitis as far as cataract surgery is concerned. Endophthalmitis is the infection in the eye, in the vitreous cavity. The incidence today is 1 in 10,000. 1 in 10,000 in the best of best places. So even the best of the best place in the world cannot avoid endophthalmitis. At some point of time, it will come. We don't know from where it comes, but it does come. It is if a bacteria enters the eye when we are doing the surgery, or after the surgery bacteria enters the eye, endophthalmitis can happen. So that is a risk. That's the reason why we don't do both the eyes together for cataract surgery, because of the risk of endophthalmitis. The second risk is that we have to calculate the IOL power when we implant inside the eye. So the calculation is made after measuring your eye length, your corneal curvature, your anterior chamber depth. About 6 or 7 parameters are there which we measure, and then use mathematical formula to derive the lens power. These formula are only 95% accurate. The formula itself is having a 5% chance of error. The measurements itself can have error. So when we have errors in measurement and errors in the formula, we may not be able to achieve that exact point. For example, if a person needs a EDOF lens of plus 21 diopters, and if I implant a plus 20 diopters because my machine gave a reading of 20 diopters, then still that person will require that plus 1 aspect lens. So it requires a very high degree of precision and very high experience to implant these kind of lenses. But with more and more doctors using this technique and using these lenses, it will become more prevalent. And if you know someone who wants to take away glasses or who has a cataract, you ask them or you tell them about EDOF lenses, because multifocal is gone. Even today, most of the doctors will tell you only about multifocal lenses, but the time for multifocal is gone. The time is now for EDOF lenses. It is just like EVs. The time for all petrol vehicle, diesel vehicle is gone. Only electric vehicle is going to be there after 5 years. If these cars will become vintage cars after 5 years or 10 years. So multifocal will also become a vintage thing, only to be kept in museum. So spectacle-free vision is definitely a reality for those above 40. And if they have a cataract at any age, definitely they should go for spectacle freedom after the cataract surgery. There is no point in doing a cataract surgery and then wearing glasses after the cataract surgery, because you had the option of doing cataract surgery and not wearing glasses. So when you have some patient asking you about some cataract or anything, tell them that you have a possibility that you can be free of glasses too after the cataract surgery. Thank you very much for the opportunity, and if there is any question or anything, I would like to take the question.
Patients complaining, watering from the eye at the time of going to bed during night time. What are the causes?
Watering from the eye when they are going to bed, there is no organic cause for it, sir. There is probably it's just during the daytime they are blinking, and because of the blinking action, the tears which are secreted in the outer corner of the eye, they go to the nasal lacrimal sac and they are draining. When they are lying down, since they are not blinking, the tears are produced, it is not going to the nasal side and it is coming out. So probably that we call it as a lacrimal pump. The lacrimal pump is not working properly for them. So it is, we call it epiphora.
What is the approximate cost of this surgery, sir?
The cost for EDOF lens surgery, if there are two different varieties. One is with cylindrical power and without cylindrical power. In our hospital, for patients without cylindrical power, we charge 68,000 rupees without cylindrical power. With the cylindrical power, we charge 88,000 rupees for one eye. This is all inclusive cost.
So overall risky individuals for surgery, say, endophthalmitis is one of the complications. In your experience, diabetic patients.
Yes, this is a good question. The toughest cataract surgeries are patients in whom the pupil does not dilate well. You all know the pupil is normally 2 millimeters. In dim light, it can even, in bright light, it can go up to 1 millimeter. In dim light, it can go up to 8 millimeters. Now, for cataract surgery, we are removing the lens, which is about 12 millimeters, through the pupil because the lens is behind the pupil. Now, if the pupil dilates to 8 millimeters, it is easy for me to remove a 12 millimeter object through a 8 millimeter hole. Imagine if I have a 3 millimeter hole through which I have to remove a 12 millimeter disc. It is very, very difficult. We are doing those cases also. We use some manual methods to stretch the pupil. So, difficult cases are cases in which pupil does not dilate. So, to whom the pupil does not dilate? Diabetic patients, the pupil will not dilate properly. Second, patients with prostate problems who use antiprostatic that medications, tamoxifen or whatever medication. Yeah, that medication when they use, the iris becomes floppy. We call it floppy iris syndrome. So there also cataract surgery is a very challenging thing. And the other thing is that cataract should not be let to become very mature. Previously, we wanted the cataract to be mature so that we can remove the whole thing easily. Today, we are dividing the cataract into small pieces, cutting it into small pieces. So we want the cataract to be like butter. We don't want the cataract to be like an apple or like a hard jaggery. Then it becomes very difficult to cut the cataract. So a mature cataract, and when the pupil does not dilate fully, these are the most difficult situations for doing cataract surgery and this EDOF IOL surgery.
The popular does it come to underwent cataract surgery with intraocular lens? Again, we have to remove and
it is theoretically possible. It is possible. We have done that also, but it is very difficult because when we remove the lens, what has already been implanted, sometimes the lens is stuck to the posterior capsule too much. So when I remove the lens, the posterior capsule also comes out. When the posterior capsule comes out, I cannot keep the new lens. The challenge will be there. So that is why we don't generally advise that.
So does it come under Chief Minister's insurance scheme?
Till 7 years ago, cataract was there in the Chief Minister's health insurance scheme. But because the volume of the cataract cases are so high and everybody wanted the health insurance claim from the Chief Minister's scheme, they removed cataract from the health insurance.
So, Kannoli Vadanam picked up the.
So is it very common tearing post surgery, post cataract?
Post cataract surgery tearing is because if somebody has got a suture, if there is a suture, if there is an irritation in the eye, automatically reflex tearing will happen. The other thing is if there is a chronic inflammation in the eye also, tearing will happen. But generally, if well performed cataract surgery, the person should not have any tearing at all. Eye should not be red, there cannot be inflammation, there cannot be tearing.
I didn't have any redness, but I had persistent tearing for very long days.
How long did you have that tearing?
Only for about 6 months.
6 months. And you used to continuously use to water?
I used to.
Probably you had some mild inflammation was there. Because otherwise, without inflammation, the tearing will not happen. It could have been there. Some patients, there can be inflammation. Not infection, only inflammation. Yes, sir.
Thank you very much, Dr. Prakash, for a very good, highly informative lecture. As a token of appreciation on behalf of Indian Medical Association, I'm handing over this.